a lot we still don't know about this virus.
Stop it. The only way to kill it. The Chinese, they believe the government lied to them. They believe that they knew about this. It was going on for 2 months before they did anything. There's a lot of anger.
It became a crisis. It was just out of control.
Italy waited too long. South Korea responded immediately.
20% unemployment may be a small number compared to what it could be 6 months from now.
We don't want the airlines to go bankrupt. The consequence would be catastrophic.
But you're still saying 18 months.
I think that's extremely aggressive because of the phases.
It is extremely aggressive? Or
It
it's
is.
Not?
It is.
Even 12 to 18 months?
Yes.
It is. How long can we really sustain this?
Younger people are going to the bars. They're the most dangerous because they don't even know they're ill.
How bad can this thing get?
Right now, the death rate in the United States is 2%. That's a lot of people.
So we have the solution right now with a drug to fix it.
What if it has a side effect no one anticipated?
Why don't we do social distancing for those above 50, but below 50, let them go to work?
They go back home, they're infected, and they kill their parents and grandparents? Is that what you're telling me? Let's kill all the capitalists off. We want all the CEOs, the vice presidents,
I'm not saying that.
middle management. No, I'm not saying you're saying
I'm
it.
saying if you're my CEO, I'd say, dude, go home.
We're getting to the bad.
This is the bad. 80% of our drugs are dependent on China. This is a national security issue.
That's very concerning for the average person.
This is a real problem. It's a crisis. It is not the apocalypse.
Moving on to our next story now. Leaders of the world's most powerful economies convened virtually yesterday with the aim of coordinating a global response to the fast-spreading coronavirus pandemic. The unprecedented video conference comes as governments around the world are scrambling to contain the spread of the highly infectious virus. The meeting was also conducted amid criticism that the world's wealthiest countries had not done enough, either unilaterally or multilaterally, to combat the virus or its economic impact. Amid restrictions, curbs and lockdowns as people across the world continue to lose their livelihoods, the G20 leaders issued a statement ensuring that they will do whatever it takes to overcome the pandemic. The member nations pledged a combined amount of $5 trillion into the global economy. The amount is aimed to boost funding for a coronavirus vaccine and to resume normal flow of goods and services as soon as possible. The funding will also additionally help developing countries overcome the global health crisis. The G20 countries also formed a task force to jointly combat this pandemic. The first ministerial task force meeting will be held in the month of April. Indian Prime Minister Narendra Modi interacted with his counterparts in the virtual G20 summit hosted by Saudi Arabia. India's Prime Minister stressed the need to put humanitarian interest first over purely economic concerns. He lauded how in just 3 months since the crisis began, all countries finally came together for considering a coordinated response. Prime Minister Narendra Modi also asked world leaders at the summit to turn the challenges posed by the COVID-19 pandemic into opportunities. India's Prime Minister also conveyed to his fellow leaders that medical research and development into the virus should be shared freely and openly. He also suggested that the nations must develop more adaptive, responsive, affordable and humane healthcare systems and resources that can be deployed globally.
Math guy, I'm a guy that studies exponential growth. We started a business from 66 agents to 14,000 agents in 49 states because the whole idea was about how can we exponentially grow. So it's the only thing I paid attention to in high school and college was math. Only thing. Everything else I could care less about, right? So when I look at data, I look at it from a different perspective. That concerns me. You know, here's one thing you said. You said you're able to control in the country. So this happens in Hubei, Wuhan, which is part of Hubei. 50 to 60 million people live in that area, whatever the numbers. You've heard 50, you've heard 60. And then it goes to Thailand, first country I think that has the case. And then it goes, Thailand then somehow comes to US because a guy was traveling to Washington who was just in China. 30-year-old guy gets it, first case. And then all of a sudden 150, 160, how many countries we're at right now? I don't know the exact, I think it's 160 plus where we are right now. And it's not as infectious as some of these other ones, right? So my challenge becomes, if you have a daughter and she's 18 years old, she's dating a boy who has AIDS, not because he got it from sex, but because maybe his mother had it and the blood, something. What I'm trying to tell you is, would you let your daughter date this guy and wouldn't you have certain fears? So if we know China has a wet market, why is US okay with, the travel? They're not creating more travel restrictions. Why does a country like US, who has the authority to tell China, listen, if you don't clean house with the way you have these kinds of things, I'm sorry, we're just not doing business with you. We're not going to let your people travel to us. So to me, the concern of me long term as a parent and as a person that runs a business goes to travel. If this has to be addressed through travel, if it's not addressed through travel and it's too easy of doing that with every country, Eventually, if somebody has the virus, it's going to come to you, and you never know where it's coming from. Right. So I don't know the answer to it. That's why I asked you thinking what you would say.
I think this crisis is going to cause a review, a rethinking of supply chains, a profound rethinking of supply chains.
I hope so.
Yes.
Not just the pharmaceutical industry, because now Apple realizes they've got 5 countries or 7 countries producing the components of an iPhone that's produced in China. If one of those sequential parts of the supply chain shut down, they can't produce the iPhone. They've created a system that's highly efficient, keeps the price down.
That's America's fault.
I know.
That's
absolutely.
America's fault. I'm sorry. That's
You're
America's
right.
fault.
You're right.
Because 2 reasons. The consumer wants to pay cheaper, and the entrepreneur wants to sell it for make bigger profits.
Correct.
Guess what? This product's going to be 20% more, but guess what? It's made in America, period. It's made in U.S. You don't want it, don't buy it.
Right.
You know, if you want to go buy a cheaper product that's made in U.S., but it's not as good of a product, you don't have to buy this thing. But I do think you're seeing more and more bragging rights about companies saying made in U.S. I think that's going to go even to a whole different level. Yes, when I'm seeing a company say made in U.S., I want to buy the product and support it.
Let me mention one last thing we could do. We could set up, CDC was trying to do it, AID was trying to do it. The funding has been cut off from it. No one took it too seriously. AID was identifying the 2,000 viruses that are the ones that, because there are like 150,000 viruses they've identified. Something, I don't know the exact number, but it's an enormous number. But most of them are not a threat. They've identified through a project that AID ran with funding from the Congress that came out of, I think the Ebola, it was out of the Ebola supplemental budget. And it created a system for identifying those viruses and then setting up a sentinel surveillance system around the world to give us early warning. We have an early warning system for famines that we started in 1985. There's been a substantial drop for the first time in history. The first time in history there's been a massive drop in famine deaths is because we have an early warning system to tell us when this is about to happen. We need an early warning system around the world when these virus outbreaks take place and to give us the time. You know what the biggest problem is in the response is time. 3 weeks in an emergency response in a fast onset disaster like this is a huge amount of time. If you made decisions, the first week that this happens,
I agree.
You can stop it.
I totally agree.
Yes, but you need a surveillance system.
Yeah, but you can't do it if it's in another country that's not doing it at the levels that you're doing it at. That's what I'm saying.
You can set up
you're
a
not
system.
in charge of that.
You can set up a system.
You may be able to set up a system, but if they don't want to follow the rules you're
No,
following because
I
it's
know.
a totalitarian,
No.
what are you going to tell them how to do?
I understand that. But there is a way of checking what's going on in other countries without actually being yourself in terms of Americans in those countries.
So we have to do more to get earlier warning. We have to do more internationally to build capacity and try to prevent an outbreak anywhere it starts from becoming an epidemic. But we also have to do more in our own country. So whenever we do have a major outbreak like a pandemic, that we can respond better in the United States. And we have to have incentives that the private sector is more part of the solution. We can't be totally dependent upon, say, the CDC for laboratory testing, as an example. And so we need to have systems in place that the private sector's part of the preparedness activity from the start. We can't just turn it on like a switch when there's a crisis.
Find a way to make it profitable to them.
Absolutely, absolutely.
Go make money on it. I don't care what it is.
That's hard, but we've been talking about it a long time, but we got to figure that out.
You find a way to give them that credit. By the way, does 5G have anything to do with this or not at all? Have you seen any reports with 5G in this or not at all?
I have not.
Nothing? Okay, one of the conspiracies is 5G, by the way. I don't know if you've seen that or not.
There's a conspiracy that
about 5G. Go look it up.
That it's related to this?
Oh yeah. They're saying that 5G with the waves is helping this thing spread. I don't know if you followed any of this stuff with 5G. 5G's threat on, well, that's a whole different topic. I don't want to go to it. Mm-hmm. All I can say is this. I really enjoyed this conversation. I want to say it's a couple hours. To me, it feels like 5 minutes. Thank you so much for your help and coming out and giving us all the insight and being willing to take some of the questions and pushback, because that's how we all learn. And hopefully if this thing, if we have more questions and this is formulating a little bit more in the audience wants you guys back, hopefully we can invite you guys back in the future as well.
Thank you very much.
Thanks so much for coming out. I'd shake your hands, but you know why we can't, because of the time. Yes.
These are desperate days in New York. With more than 3,500 new cases in the last day alone, medical facilities are critically overstretched. A long line of worried people wait outside this hospital in the borough of Queens just to be tested for the virus.
Almost any scenario that is realistic will overwhelm the capacity of the current healthcare system.
That's why the authorities are drastically stepping up their response. This hospital in Manhattan is setting up a makeshift morgue, getting ready for a wave of deaths.
A morgue? That's creepy. That's creepy.
On a temporary morgue? Oh, God. I don't know. It's awful. It's awful.
Well, I'm scared to be here. That's why I'm obviously wearing a mask.
A determined President Donald Trump insists the battle will be won.
We are waging war on this virus using every financial, scientific, medical, pharmaceutical, and military resource to halt its spread and protect our citizens. I know that we will achieve victory and quickly return to the path of exceptional health, safety, and prosperity for all of our citizens.
Other emergency measures include this 1,000-bed US Navy hospital ship, due to arrive in New York Harbor on Monday to ease the pressure on the city's own hospitals. Normally packed Times Square is now eerily deserted, with no tourists in town and New Yorkers heeding a government ban on working and socializing in public. A city already in fear knows that the worst is still to come.
Let's check out the situation then in the US with DW correspondent Oliver Salit in Washington. Welcome, Oliver. Why is President Trump so confident this crisis will be resolved soon?
Well, Phil, I'm not even sure he is that confident, but what he's really trying to do here is to sell hope and optimism to the American public, of course, and also to the American voters, because he knows that his re-election is at stake. And, you have millions of Americans who feel very much insecure at this time, are scared, of course, of the current situation of unemployment, of the spreading virus, the pandemic. And so every day President Trump delivers this press conference in the White House press briefing room that, by the way, he hardly ever used in his presidency, and that he's now turned into something like his campaign rally, if you will, with the major message being always like, it's all going to be good, it's all going to be okay, we're going to go back to work soon, and the stock markets will go back up again. That's another very important aspect, of course, here in the United States. So experts and his own health experts in the White House see that differently, but his voters like it, and you can see that in the job approval rate of President Trump. That's as high as it has never been in his presidency.
And the US, like the rest of the world, is facing an economic crisis. Unemployment claims that last week were the highest recorded ever.
Yeah, that's right. And we're now in a situation where more than 3 million Americans filed unemployment, but there are some respected economists who believe that this is not just the beginning, that this number could go up to 46 million within this crisis. So the worst is certainly yet to come, not only with regards to the pandemic, but also with regards to the economic fallout of the pandemic. And that's, again, very threatening for Trump's re-election bid, because he's always made the case that this is the most successful economy and the most successful stock market of all times. This is basically essentially Trump's take and why he should be re-elected. But this all is turning into the exactly opposite.
Except that they have pumped an unprecedented $2.2 trillion into the economy. Well, this is the hope anyway, this rescue package that cleared the Senate and is expected to be voted on in the House on Friday. Is this going to be enough to ease the strain, not just on the health system, but on the whole of the US economy?
All right, it's again an unprecedented sum, money that is urgently needed, and as you say, is mostly needed as a kind of emergency relief, so to compensate people and businesses that are suffering from this situation right now, from the lockdowns across many economic centers in the United States. But if you look at the health system, that in particular in the epicenter in New York, that many health workers there describe as catastrophic, where fridge trucks are used right now to store the bodies of deceased patients in the hospitals, well, then money, of course, is necessary and would help, but only if the necessary material is available. And New York's Governor Andrew Cuomo desperately is calling for 40,000 ventilators, for instance. He's also stressing that the healthcare system is running out of supplies very soon. So money is certainly not the only problem here. It's also the fact that the material is not available on the market.
Oliver Salet in Washington, thank you. Well, half of the world's more than 500,000 confirmed coronavirus cases are here in Europe. So this crisis is likely to hit the bloc harder than the previous economic and migration crises. The European Central Bank's already announced unprecedented action to support EU members and businesses, but member states can't agree on how to distribute the financial burden, and this is resurrecting old fault lines between North and South.
Protective gloves, now a regular feature in the European Parliament. The Assembly is largely empty. MEPs who do attend are taking extra precautions. On the agenda, forging a common EU response to the coronavirus crisis.
When Europe really needed an all-for-one spirit, too many initially gave an only-for-me response. And when Europe really needed to prove that this is not only a fair weather union, too many initially refused to share their umbrella.
An umbrella some EU members remain reluctant to share. That includes von der Leyen's home country, Germany, even as the pandemic storm intensifies across the bloc. Thursday's 6-hour video conference with the EU's 27 national leaders ended without agreement on just how unified the economic response should be, especially when it comes to sharing debt across the Eurozone.
We reject communal debt. This is an old system that has not been used in the past.
The countries hardest hit by the pandemic so far, Italy, France, and Spain, are among 9 EU countries in favor of so-called corona bonds. Opponents, including the Netherlands and Finland, prefer the European Stability Mechanism, set up in 2012 to respond to the euro crisis. The ESM can lend money to members in trouble, but with strings attached. Now Eurozone finance ministers have 2 weeks to figure out the details, a long time in the life of the rapidly spreading virus.
Let's go to Georg Mattes. He's following developments for us in Brussels. Georg, we had a pretty strong condemnation there today. Where does Ursula von der Leyen, where does she see this lack of solidarity now?
Let me give you 2 examples, Brent. One is the export of those essential masks, but also protective gear for doctors. And that export did not take place. Italy, for instance, needed those masks, and they did not get them from a fellow EU member state, but in the end they got them from China. Another example is the closure of national borders at a time of crisis, creating traffic jams, risking the frequent flow of goods in the internal market. And that is why Ursula von der Leyen has said, let's coordinate all of this, let's make a European stockpile, let's also make sure we close the external borders so that internal borders can remain open.
Okay, those are her suggestions. What came out of the video conference today? Were there any solutions that were offered?
It looks like we're having a row here over the financial means to help in the corona crisis. In other words, help the economy. There's a draft conclusion of this virtual summit, and in it says the European Stability Mechanism should be used and finance ministers should look into that. There is, however, no mentioning of so-called corona bonds or mutual bonds in the EU, because behind the scenes already the Netherlands, but also Germany, said they do not want these bonds. They still believe that nations in Europe can get debt from the debt market, so they are still stable, and so those means are not necessary yet. And the Italian Prime Minister, in the meantime, has already said he has rejected those draft conclusions, and he has given the EU 10 days to come up with an adequate plan how to financially secure the future of Europe.
Yeah, it seems like we're going from one crisis to the next at the moment. Georg Mattes on the story for us in Brussels. Georg, thank you.
Well, let's take a look at some more of the latest developments in the coronavirus pandemic. 3 months into the outbreak, and the total number of confirmed cases has passed 500,000. The death toll is more than 24,000. France has reported the 5th highest number of COVID-19 deaths, and its death toll is still climbing. It's jumped by a quarter in just one day. And German company Bosch says it has developed a coronavirus test for use in medical facilities that delivers results in 2.5 hours, twice as fast as other tests. Well, the virus poses a particular danger to people living in Greece's overcrowded migrant camps. On Lesbos and on other Greek islands, tens of thousands are packed together in squalid conditions with little health care. An outbreak could be devastating.
Lesbos a few days ago. Migrants sew face masks, offering protection to others in the camps here as well as new arrivals. Now, though, the island is in lockdown. Built to house 3,000, 20,000 people live in this camp. Now it's cut off from the outside world. Peter Cesar from Doctors Without Borders says his organisation has long been calling for an evacuation, and now things are much worse.
They know they are trapped, and they know that there are no measures taken by the authorities to protect them against the virus. And that's another issue. So there is a real threat that this will be a medical and a humanitarian catastrophe. But there's also the fear that is going on, and we might see a lot of panic.
Hygiene is a big problem here, and with social distancing virtually impossible, any infection would spread extremely rapidly. There are just 6 intensive care beds in the island's main town. The very weak and sick, including chronically ill children, would need to be transported to the mainland. Germany's SPD party has appealed for action. Germany and some other European nations have offered to start by taking in around 1,500 people, mainly unaccompanied or sick children. It's just an initial step, and it now needs to happen very quickly. The European Commission is responsible for coordinating it all. An evacuation would be quick to organise, says migration expert Gerald Knaus. There are 800,000 beds in hotels in Greece, with only around 7,000 in use. 10,000 people on the islands could be accommodated on the mainland. The International Organization for Migration is now building temporary, safer camps to move people to. Yet so far, there's been no evacuation. It's time for European solidarity, says Knaus. Those with refugee status living on the mainland could be taken in by other EU countries, with all the accompanying healthcare protection they offer. MEP Eric Marquardt has been on Lesbos for several weeks. He's been documenting the inhumane conditions of the camps. The EU Commission must coordinate the quick evacuation of people from refugee camps to individual member countries, and we must work out how to ensure that hygiene and medical standards are adhered to. The EU Commission says it hopes that countries will be able to begin taking in children within the next few weeks.
Well, South Africa has confirmed its first 2 coronavirus deaths as the number of confirmed cases rises to more than 1,000. The news comes at the start of a 3-week nationwide lockdown to stop the spread of the virus. The military has been deployed to help enforce measures that include restrictions on people leaving their homes for anything but essential trips. Alcohol sales and dog walking have also been banned. DW Africa correspondent Adrian Kriech joins us from Cape Town. Welcome, Adrian. What's it like there on day 1 of this lockdown?
Well, Phil, you can see it behind me. It is empty. I'm on normally one of the busiest streets in the center of Cape Town on Long Street, and there's almost nobody here. Everybody is forced to stay at home, as the sign says right behind me. This is the order for the next 3 weeks, and it will be enforced according to the president and his ministers. Nobody is allowed to leave the houses, only for essential services. If you go to a supermarket, for example, but you're not allowed, not even alone, to walk around, to go for jogging, to walk your dog. This is all forbidden. So it's 3 very tough weeks ahead for South Africa, but it is a necessary step, the president says. Looking at the numbers, how they are growing, they have reached more than 1,000 corona cases today.
So following on from those numbers, how is the country's healthcare infrastructure coping?
Well, at the moment it is still coping rather well, but this is at the moment. The reason why President Cyril Ramaphosa took the decision was quite clear. He knew that the health system is likely to collapse if the numbers continue to grow the way they have grown in the past days and weeks. 80% of South Africa's mainly poor population is catered for by the public health sector, and it's already now overwhelmed in the townships where millions of South Africans are living in very bad conditions. Access to healthcare is a massive problem, and it's going to be a worse problem in the weeks to come. Experts predict that the number of cases will still continue to grow for at least 2 weeks, and then hopefully we will be seeing a decline, and that hopefully will give the health sector a chance to recover and not be totally overwhelmed.
And all this in a country that was already in recession with an unemployment rate of 29%. What's being done to lessen the economic impact of this crisis?
Absolutely, Phil. More than every second young South African is already unemployed now, and it looks very bad for the future of the country, depending how this lockdown will work or not work. Many people here have the feeling, with the support of the government, they came up with a number of packages to support small businesses. The economy could survive for the 3 weeks, but it is not clear if maybe it could be extended in the future after the 3 weeks. It is not successful. Nobody knows how things develop afterwards. Will tourists really come back right away? Remember, the country heavily relies on tourism, which brings a lot of income, and at the moment that sector is basically dead. Hotels shut down, restaurants are shut down, so the outlook is not very positive at the moment, but South Africans still remain optimistic that things will get back to normal after this lockdown.
Thank you for that. Adrian Krish in Cape Town.
A U.S. Defense Secretary official says China is engaging in steady-state competition with the U.S. That means China's economic and military projections are challenging the U.S. on a global scale without armed or violent conflict. The Defense Secretary says China's leader is telling his army to prepare for war.
Thank you for being here.
While discussing China's military projections, a U.S. Secretary of Defense on China suggested the Department of Defense should reorient its strategic competition with China. A specialist on U.S.-Asia issues pointed out China's military and economic operations, which present a challenge for the U.S.
You talked at some length about and responded in questions to the steady-state competition that we're in. And using your own term, I'd like to foot stomp this as well. I think the challenge is a daily one. It's urgent, it's multidimensional.
The Defense Secretary said the U.S. must not wait and try to be prepared for a violent conflict with China, but must be aware that the conflict has already started as a result of China's peacetime preparations for war.
What Xi Jinping has told to his own PLA, which is to concentrate on preparations for war, which is steady state, preparations, right? Setting conditions, being prepared so that if the time comes, is that he can employ them as needed.
The U.S.-China Security Review Commissioner noted the U.S. needs allies in order to confront China diplomatically and politically.
There are 5 major allies in the Pacific: Japan, Korea, Australia, Thailand, and the Philippines, all have as their number one trading partner China.
The Defense Secretary said while U.S. alliances with countries in the Indo-Pacific are robust, using Chinese technology may present a security risk.
We have to be very clear-eyed that these countries are becoming under increasing pressure from multiple different lanes: diplomatic and economic pressure, political coercion.
Another commissioner pointed out China doesn't have a long history of allied relationships with meaningful countries that the U.S. has.
I mean, their allied relationship seems to be more driven by coercion and fear than by common interest.
But the Defense Secretary said China rejects alliance systems. He explained that instead, it adopts strategic partnerships while quadrupling its Marine Corps and developing long-range tools like
long-range air forces and other kind of ballistic missiles and hypersonic missile, long-range missile capacities, and then certainly cyber and space capacities, which are not dependent upon any sovereign issues at times.
According to the Defense Secretary, China's ability to support infrastructure projects like One Belt, One Road creates competition for the U.S. outside of a hot warfare scenario.